Yeah, so what we have done so far is in ARTIS to set up a cross-sectional study of 75 patients which are at different stages of Alzheimer's disease. So we have cognitively normal ones, we have patients in the prodromal phase, we have patients with mild dementia. And we have very deeply characterized them, in fact. Yeah? So with respect to clinical characteristics, with respect to sleep. And now we are also investigating immune profiling and perform single cell sequencing currently actually of PBMCs, so of specific cells in the blood. You know? We have indeed also a very deep characterization of sleep. And this is done in different ways. So it's done in terms of the classical questionnaires, but it's also done in terms of a smartwatch. So which patients wear, in which over 14 days, in fact, the behavior, let's say, over their night sleep is recorded. Yeah? In addition, we have come up on these data now with a number of models. Yeah? So because this data is not just collected, it's also deeply analyzed. And for example, one thing that we have done now is to come up with AI/machine learning models that based on sleep patterns can actually predict whether a patient is likely cognitively impaired currently or not. Yeah? So this may help at the end of the day. For example, a general practitioner, if a patient comes to him or her with certain subjective cognitive impairments at first place, to more objectively decide whether there is something that is, let's say, not normal in this particular patient. So we have also in fact analyzed already, or at the moment begin analyzing the correlation of these predicted likelihoods of cognitive impairment with changes of in fact cytokines in blood, as well as the volume of different brain regions. So this is also data that we have captured, so MRI data. Yeah? And we are currently also performing more in-depth investigations, so with more sophisticated methods of the MRI data to, for example, look into integrity of certain brain regions. Yeah? So, well, I mean, of course, without JPND, there would be no ARTIS. Very simple. Yeah. So, in essence, this project helped us to bring together 6 different institutions across Europe. Yeah. So, we have from Germany 2 Fraunhofer institutes. We have from Luxembourg, Alzheimer Europe. We have in Spain a hospital. We have in Hungary a company that is specialized on single-cell sequencing and bioinformatics analysis. And we have from Israel, actually, on one hand, the Tel Aviv University, and we have also a company, a biotech company, that is developing actually a drug currently against Alzheimer's disease on board. So the collaboration with all of these partners would, of course, never be possible with according funding. Yeah? So in that sense, I'm actually quite grateful for the possibility that JPND here offers. Yeah?